My name is Michelle Nishow, and I'm currently a student at the University of Maine at Fort Kent. Today I'd like to talk to you about bariatric surgery and why it's not worth taking the risk. Today, 1 out of every 3 Americans is overweight, and it's become a major health problem in the United States. People really are looking for that right now fix, and they're thinking that bariatric surgery is a treatment for obesity. Unfortunately, there are many risks with bariatric surgery that are not worth taking. There are 2 types of bariatric surgery. First is the gastric band. The band is placed on the top of the stomach, and what it does is its function is to reduce the amount of food that can enter the stomach. The second is gastric bypass surgery, and that is to reduce the size of the stomach, reconnect it to the intestine, and to only allow 2 ounces of food in the stomach at one time. The risks of the gastric bands include migration of the implant, which is the band itself that's on the top of the stomach, and that band can slip or become displaced. Tubing-related complications, which is the port connection. The port is right underneath the skin, and a tube connects the port to the band, and that band itself can become disconnected. There's also band leakage. The band is filled with saline solution, and oftentimes the band itself can leak. There's also it's GERD. You can get GERD, which is acid reflux disease. You can get inflammation of the esophagus or of the stomach. You can also get port site infection, and the port again is right underneath the skin, and that port itself can become infected. The mortality rate is 1 out of every 1,000 people who have the surgery for the gastric band. The risks to the gastric bypass, they include, and not limited to, leaks from the staple line, ulcers, dumping syndrome. Dumping syndrome is a really unpleasant side effect of nausea, vomiting, faintness, sweating, diarrhea. Also, you need to take vitamins because you're not getting enough supplements due to the amount of food that you're taking in. Your body just is not getting enough vitamins from the food intake. Increase of gas, and also the mortality rate is 1 out of every 200 people who have gastric bypass surgery die from complications of the surgery. The dangers of gastric bypass surgery really should only be risked when all other options for losing weight has been exhausted. Unless you're super obese, morbidly obese, or it's a risk of life and death, I really think that bariatric surgery should be the last resort for losing weight. Losing weight naturally is very hard, but there's virtually no risks. It is time consuming, and you really have to have commitment to losing weight. It's important to go to your physician and ask them to start a weight loss plan. Ask how much weight they feel that you should lose for your height and your age and your sex. Ask if it's okay to start an exercise regimen and what you could do to start burning fat. Get a referral to a dietitian. See how many calories you need to take in on a daily basis. And those calories are going to be adjusted as you lose weight. Also, it's really important to exercise. You need to get physically fit. It's important also to ask your doctor if it's okay to start an exercise regimen. If it is, visit a gym, talk to some of the trainers that are there, and see if they can help set up a daily plan of exercise, starting with cardio, and then possibly later on, once you're stronger, to be able to do some strengthening and to increase your physical fitness. Break up your total weight loss goal. Don't look at, let's say you have to lose 80 pounds. Don't look at the entire 80 pounds. Break it up into segments and work towards losing smaller amounts. Bring that weight loss into stages. And remember that anything worth having it's worth working for. It takes time to lose weight naturally. You didn't put on the 80 pounds or how many ever pounds you have to lose. You didn't put it on within a week. It's not going to take a week to come off. It's going to need time. So remember, it's going to take time to take it off, and you need to be patient. I'd like to talk to you a little bit about why I wanted to pick this subject of bariatric surgery. A year ago, I weighed 288 pounds, and my doctor suggested that I have bariatric surgery. I went to a bariatric surgeon. I went through all of the tests needed to have the surgery. And after assessing all of the risks, I decided that the risks weren't worth taking. In the past, I tried to lose weight with diets, but I realized that diets weren't going to work. If they didn't work in the past, they weren't going to work now. And I needed to make a life change. With the help of my doctor, with the help of a dietitian, and with the help of a really good exercise regimen, I've been able to lose 92 pounds in 11 months. And I really feel that if I can do it, anybody can do it. And that bariatric surgery it's not worth the risk. But not only that, it's not a cure, because a lot of people after they have the surgery, yes, they do lose a lot of weight, but because they never change their lifestyle, they can go back to those eating habits, and they can go back to that lifestyle that caused them to lose weight to begin with. And also remember that if you can reduce your stress, your daily stress, that can help you in losing weight, because stress can cause the body to keep that weight on. Really reflect on your weight loss goal, work towards it, and remember, if you really do think that bariatric surgery is your only choice, look at the risks, because bariatric surgery, it's not worth it. Thank you.